So I'm one of the authors of the guidelines for American College of Gastroenterology and the U.S. Multi-Society Task Force. We looked at all this gathering evidence and alarming trends that we were seeing from our National Cancer Registry data, showing that cancer incidence seems to be going up in individuals younger than 50. So, based on all of that, we actually in 2021 changed the age to start screening and we lowered it from 50 to 45. And the idea was we would try to at least get kind of this big bump that seems to be happening in the late 40s for both men and women. So, men and women that have no symptoms are otherwise average risk, meaning no family history or personal history of polyps or inflammatory bowel disease or any of the hereditary GI cancers. They should start at age 45. However, many individuals would need to start even younger than that. And we actually do mention that in the guidelines. So, anybody that has a family member, parents, siblings, grandparents with either colon cancer or one of these, advanced polyps uh, should start screening at age 40. And if they have a history of more than one relative, a first degree relative and a second degree relative, or multiple relatives, not just with colon cancer, but some of the other GI cancers, they should actually sit down with their physician, go over their family history, because there we might actually want to start screening much earlier, as early as in their 20s. So the family history really makes a difference. The other thing that makes a difference is if patients are experiencing any symptoms. So what we want is, regardless of age, anybody with symptoms of rectal bleeding, unexplained diarrhea, constipation, change in caliber of stool, unexplained abdominal pain, weight loss, iron deficiency, anemia, should undergo a prompt evaluation. We see far too many young individuals that ignored their rectal bleeding because they thought, oh, it's just hemorrhoids or something, or they were just too embarrassed to address it. And then lo and behold, we find an advanced cancer. So we also want everybody to have a very low threshold for any symptoms to seek care.
That's such a great point. See, you don't even need me on the podcast because that was going to be my next question. You could have done this all by yourself because that is such an important part. And I can't tell you how many patients we've talked to that ignored those signs at the beginning. Young men, young women, because just like you said, they may think it's nothing, it's hemorrhoids. Can we delve into that a little more? And what do you think is the reason why patients don't want to maybe bring it to their doctor's attention? And if they are experiencing those symptoms, even change in bowel habits that maybe don't look right, how could they address this with their provider? What are your tips?
Yeah, absolutely. I think there's a variety of things that get in the way. From the patient standpoint, it's lack of information. Young people just don't think of something worrisome. They also feel invincible, right? Didn't we
Right.
all in our 20s? So it's one of those, I don't think it's anything. So a lot of it is just lack of education and ignoring symptoms. Some of it is actually avoiding kind of talking about it because it might be embarrassing, or they may not actually have a doctor. A lot of young people really just go to doctors when they need to, but otherwise don't. So, thinking about, okay, I need to make a visit, schedule a visit with my physician and bring this up. So, a lot of things get in the way. From the physician standpoint, there's also a lack of awareness. So, that's another thing we tell patients is to be your own advocate. Your physician might dismiss it, but again, be persistent and say, I'm worried this might be something more worrisome, or do you think I need an evaluation, or do I need to see a gastroenterology specialist? Because as you mentioned, I've seen far too many heartbreaking stories